Hello, my name is Lauren Gooden, and today I'll be going over how to administer Narcan. So the first question you might be having is, what is Narcan? So Narcan is a drug that is inhaled through the nose and is supposed to reduce the effects of an opioid overdose. And then a second question you might be having right now is, why is this important? And this is important for a few different reasons, but the main reason being that opioid overdoses occur more often than most people would believe. It is actually estimated by the National Health Resources and Services Administration that around 130 people die every single day from an opioid overdose. And most people might not even know this because it's actually a relatively new trend that we've seen in the past 10 years, where we jumped from about 2,000 deaths annually to about 65,000 deaths. And that is actually a statistic that I pulled from the National Safety Council. And in the image that I have on my screen here, you can see this is the lethal dose required for a heroin overdose compared to a fentanyl overdose. So it only takes a very small amount for it to actually be lethal, which typically happens due to cross-contamination from other different drugs and medicines. And this is where Narcan comes into play, because Narcan when administered to somebody experiencing an opioid overdose from something like cross-contamination with fentanyl, we have a 75 to 100% efficacy rate where that person can be revived from that overdose long enough for emergency services to arrive and care for that person. Now, the third question you might be having right now is, why should I listen to you? And that's actually a valid question. So I'm a junior in biomedical health sciences with a minor in psychology. So I've learned quite a bit over the past few years about how the brain, body, and drugs work. I've also been trained on how to administer Narcan from the Purdue Pharmacy Association through one of their training sessions. All that to say, my plan here in this video is to help you know, 1, how to identify when somebody is experiencing an opioid overdose, and 2, how to treat that person with Narcan. And just a heads up, all the steps that I'm about to outline to you are listed on the CDC website. So going into a bit of a prerequisite here, you first want to know how to identify an opioid overdose, and there are 3 main symptoms that you can see on the person. The first being pinpoint eyes, where the person has very, very tiny pupils, as seen in the image. The second one would be slow and shallow breathing, where the person might be breathing at a very, very low rate or might be experiencing periods of time where they're not breathing and then gasping for air. And the third clear symptom is cyanosis, otherwise known as a pale or blue discoloration of the skin, namely in the fingertips and the lips. Step 1, and arguably the most important step that we have here, is to call 911. The sooner you can call 911, the better, because that is the sooner that the emergency services can get to you to help that person survive. It is very important that you do not forget this step. Also, the operator on the other line can help guide you through these steps if you happen to forget, or if you're in a situation where following these steps might not be feasible. Step 2, actually administering the Narcan. So step 1 here is to remove it from the packaging, obviously, and I do have it in real life for it to look a little bit more obvious. Now your second step here is to hold it. You're going to want to hold your middle finger and your pointer finger on top of the Narcan, and then your thumb holding the plunger. Your third step is going to be to insert the nozzle into the person's nostril. It's important that you only put it in one nostril. If you try and do both, you're probably not going to be able to inhale all of it. And your fourth step here is to hold your thumb down on the plunger to activate the nozzle. And now step 3 here, after you've actually administered the Narcan, you're going to want to put that person in what is called the recovery position. And this position is actually used for any kind of substance-related overdose or intoxication. All you need to do is lay that person on their side. That way they don't ingest or inhale their vomit in case they do. You're going to want to put their hand under their head. That way their head stays up so they can get some nice airflow. And the third thing is to put their top knee out next to them, so that way they can't roll over. It just kind of grounds them to the ground. Now our fourth and final step here is to just stay with them until emergency services do arrive, and to make sure that they're staying awake and to try and keep them alert and consciously active. And also, if they begin to slip out of consciousness again, you can also re-administer the Narcan if you happen to have a second one. Something to highlight here is there's no harm in administering Narcan once or twice. There is no adverse side effects or consequences for administering it, even if that person is not experiencing an opioid overdose. So there is no harm to administer it a second time. So just a little recap here, I created a little acronym to remember it called CARA, C-A-R-A. Number 1, call 911. Most important step. Number 2, administer the Narcan. Number 3, recovery position. Number 4, attention. I hope that after this presentation, you feel comfortable enough that if you were in this situation, you would know how to administer Narcan and be able to help save that person's life.